Welcome to episode 181 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. Dr. Melody Hartzler joins me today to talk about functional medicine, continuing education, PharmToTable LLC, her podcast, which is called Table Talk, and more. If you are a functional medicine pharmacist or functional medicine pharmacy curious, you need to listen to this episode. If you are new to the Pharmacist Voice podcast, welcome. Again, my name is Kim Newlove, and I'm the host. I'm a pharmacist by training, but I'm not in clinical practice anymore. I made a career transition to voice actor and podcast host. Among other things, I narrate audiobooks for women pharmacist authors, provide medical narration to clients in the pharmaceutical and biotech industries, and narrate content for explainer videos and e learning projects. I was inspired by my nonverbal son who has autism to combine my background as a pharmacist with my speaking voice and launch my business, The Pharmacist Voice, in 2017. My son Craig helped me realize the power of having a voice and using it. My solo podcast episodes are about some aspect of being a pharmacist, a voice actor, a pharmacist podcaster, or my career transition from pharmacist to voice actor and podcast host. My interview shows feature a variety of people who use their voices to advocate for something, educate in some way, or entertain so that you are inspired to use your voice too. This is episode 181, and you can find the show notes on my website, thepharmacistvoice.com. Just click on the podcast tab and search for episode 181. Without further ado, here's my conversation with Dr. Melody Hartzler. Hi, Melody. Welcome to the Pharmacist Voice podcast. How are you?
Good. How are you?
I'm good. Go Ohio. We are two Ohio pharmacists. Yeah.
Yes. Yay. OH.
IO.
Except I didn't go there, but I still support the football.
I didn't go there either. No, that's great. I think it's like a geographic thing. You just kind of
Mhm.
support the local team, which is Ohio State, the
Yeah.
Ohio State, right?
Right. Yeah. And our pro teams weren't very good for a long time, and we had to root for the college team.
We are long-suffering Browns fans here in my house, and yeah, I know that didn't the Bengals make it to the Super Bowl last
Yes.
year?
Yes. We are a house divided. My husband is a Browns fan, and I grew up in the
Ah,
Cincinnati area. So we definitely rooted, though, for the Bengals last year. And my son is 5 and definitely got into it. So it was fun.
yeah, it's okay to root for those Ohio teams now, right?
Yes. Yes.
Yeah, awesome. Well, again, welcome to the podcast. And I
Thanks.
would love to have you start off by talking a little bit about what you have coming up. There's something coming up in November.
Yeah.
What is it?
Yes. Yes. So our website, one of our websites is functionalmedicinece.com. And we are a online continuing education platform for pharmacists interested in learning more about functional and integrative medicine. And we have a conference that is coming up, like you said, on November 12th. And this is going to be a 7-hour CE conference for pharmacists focused on anxiety and depression. So there's all kind, functional medicine is really the root cause treatment of these conditions. And we really, in many conditions, the conventional approach just doesn't get the patients where they need to go. They need to bring in other supplemental care. And that doesn't mean they necessarily are always going to stop medications, but it means we can make their quality of life a lot better in a lot of situations. So pharmacists are really poised for being part of that functional medicine team and really helping those patients get better outcomes. And so that day, we're going to start talking about sort of like how this whole pathophysiology piece goes awry in some of these disorders as far as anxiety and depression and the gut brain axis, talking about the microbiome, how that influences the brain and brain function, and then also some of the lab workup. So what do we do from a lab standpoint that's different than the conventional model? And then also pulling in the nutrition piece. So as pharmacists, first line therapy for there's a lot of debate about where our scope is on nutrition, and we could talk about that for a whole hour, which we're not going to. But I think, almost every disease state, first line therapy includes some kind of initial recommendation from a dietary and lifestyle modification. So we want to bring in the data on, what types of diets have been studied in these conditions, what types of diets are going to have the nutrients that are needed to support someone's cognitive function and mental health overall. And then one of the exciting things we're going to be doing is we have a pharmacist on our PharmToTable team that is a passionate anxiety health coach. And so she's going to be doing a workshop for pharmacists post-conference. That's going to be an add-on for people to really get into that like mindset coaching, and really an introduction to what that looks like. And is that something that they can incorporate in their practice? So we're really excited about this topic. We've not delved much into as the anxiety and depression. We focused a lot on pain and gut and autoimmune and other things. And so I think this is just going to be a really cool topic.
This sounds like something that's appropriate for pharmacists who already identify themselves as functional medicine pharmacists. Would you agree with that?
Yeah, but I think it's our content too, I think is great at any level of introduction to the is this something that's interesting for me? Certainly there are full out curriculums in taking you from A to Z and preparing to be part of a functional medicine team. But I think our CE, like any pharmacist can really jump into this. And there's some times where you might have to go back to like some of the basic gut restoration things when we're talking about other conditions. But I really do feel like anyone that's interested in anxiety and depression and finding like alternative pathways, holistic care for patients can participate.
Well, I love it when you have a broad audience. I just
Yeah.
didn't know, I didn't wanna keep anybody away
Yes.
from your
Yes.
course, but,
Yes. For
hey,
sure.
knowing your audience is good, and
Yes.
when we talk
Yes.
about it, then everybody feels
Hmm.
invited because, like you
Yes.
said, everybody's invited.
Yes, exactly. Yeah. And a lot of pharmacists always tell me, like, I'm so glad I can find a place where I get CE hours and something I'm actually interested in learning.
Yes.
Because so often we're doing CE, we're like just getting it to get it because we have to do it for our licensure. But if there's, and maybe a lot of times people find us because they want to learn for themselves. Like a lot of pharmacists are in a place right now where that's something they struggle with themselves and really want to be able to support their own health because we can't help other people and advocate for other people well unless we're taking care of ourselves well too. So that's another sort of place that might send you to, hey, maybe I should engage on that day.
Yeah, that's a nice bonus. If someone has a personal interest for their own
Yeah.
health, they can learn
Yeah.
about it too.
Yeah.
That's
And
great.
so many functional medicine practitioners, pharmacists, doctors, physicians, nurses, that is how they got into this space was caring for them, their own selves and navigating the healthcare system and getting frustrated with the conventional medicine process. And then it was like the light bulb is, you're continuing to learn. And we're all continuing to learn in this space because we're learning so much all the time. But most people, it's either themselves, a spouse, a child, some reason that brought them into this learning.
You mentioned that other healthcare disciplines are interested in functional medicine,
Mhm.
and you offer pharmacist continuing
Yeah.
education credits, but do
Yeah.
you allow nurses, doctors, physicians assistants, etcetera, to attend this live CE event?
Yes, so they can attend. We currently don't offer CME, which is the continuing education credits for physicians, and sometimes nurse practitioners can use those as well. So at this time, our audience focus is pharmacists because we began by sort of filling the gap that there wasn't a lot of CE with this type of content out there for pharmacists. But that's something we're exploring: is there a need beyond what the other institutions that are teaching about functional medicine have going on from a CME standpoint for other disciplines. So would love people's feedback if there's any of those other healthcare providers listening.
Awesome. Well, you've opened the door. Let's see if they
Yes.
walk through, right?
Yes, exactly.
Well, how does somebody register for this event?
Yeah, they can go to our website. You can either type in the full functionalmedicinece.com or you can just do FX, which is the abbreviation for function medce.com, and that will take you to the homepage as well. And basically it'll highlight the schedule and then it'll talk about the different levels. We also have annual passes that if someone wants all the content from this year, they can grab our cardiovascular modules that we did earlier this year, and we also did a whole day conference on cardiometabolic conditions. And then we, in September, released some thyroid adrenal content, neurotransmitter content that's on demand. And we actually did a law CE in June too. So all of that content is available to annual pass folks. So if they're interested in expanding beyond the conference, that's an option. And also you'll see at the bottom sort of the add-on if you wanted. The annual pass folks will be invited to that post-conference workshop. But then if you just want to do November 12th plus the post-conference, that's an option too. So just make sure you scroll down and find what fits for you. And then it's all happening on Zoom. So you don't have to leave your house. You don't have to, well, unless your internet doesn't work for some reason, because I've been in that position before where a Spectrum is not my friend. They have like a monopoly on the market in this area. But the convenience is so important, because I know so many pharmacists are busy. They're taking care of families, they're working full-time jobs, and they still have to do CE and want to do CE. And sometimes just getting to conferences that are at physical locations and require travel costs and things are just too much. So we're trying to make it easy, accessible, and still really valuable to our audience.
And it sounds like this is not your first rodeo. You have the
No,
other
yeah,
offerings, right?
yes,
You know
yeah,
what
for
you're doing.
sure. Yeah, we've been doing this since fall of 2019. So I always say we were doing virtual education before it was cool, because COVID obviously everybody is doing virtual education starting in
Yep.
2020. And so that has caused us to shift a little bit in our model and how many conferences we offer and those kinds of things. But yes, we started out doing just intro to functional medicine, which is still available on the site, gut health things. We did the pain and inflammation. We've done women's health. And then immune function, like how do we actually support our immune system in fall of 2020? And because that was a conversation that was all year long. So lots of great content. Even if November 12th doesn't work out for you, you can head over and browse in the shop section of the website and you'll see all of that.
Okay, I've got to ask about how much does this cost, the November event versus the full everything?
All right. So as far as pricing goes, we range from the 7 hours of CE being $249, and we haven't exactly added the price in yet on the website for the post conference. So by the time this recording releases, you'll be able to see what that add-on price is. But if you just wanted the two conferences, the two live conferences that we're doing this year, that's $399, which is 14 credit hours of CE. And then if you want the whole everything of the year, the on-demand content, law CE, we're even doing med safety CE, that's $499 for a year. So you're getting all your CE hours for the year, plus meeting some of those buckets like the live CE hours that you might need, the law CE and the med safety CE as well for that price. So we think comparatively to a lot of other functional medicine education that it's definitely really reasonable for pharmacists. And we've gotten a lot of great feedback. And also we're looking at maybe doing some more live events in the future, in-person events too.
Well, congratulations on your
Yeah,
success and good
thank
luck with the
you.
November event.
Yes, yes. We'd love to we're dreaming of a CE cruise too, a functional medicine CE
Oh,
cruise. So,
cool.
so we'll see what that looks like if that gets on the schedule for next year or the following year.
Oh, I gotta tell you though, the food on those cruises, not exactly conducive for health, but
I don't know. There's some really good options. I mean,
right, you could challenge yourself to find the
right.
good food, right?
Yes, yes,
Yeah.
yes. We won a Disney cruise this year, and we actually went on one of the
Congrats.
inaugural Disney Wish boats, and the food was amazing. I mean, certainly there's lots of dessert and lots of things you probably shouldn't eat, but there's lots of good things too.
Well, that's good to hear.
Yeah, yeah, for sure.
Awesome. Melody, why do you think so many pharmacists are going into functional medicine?
It's a great question. I think it comes back to our desire and passion to like help people. I can tell you from the academia side of my career, I've interviewed a lot of students going into their entry, pharmacy degrees, and they're coming out of high school and they're saying, hey, I wanna help people. I want to serve people. And for some reason, the path for medicine may have seemed overwhelming, or they really wanted to focus on the drug therapy and the really accessibility. Pharmacists want to be accessible to patients. We're one of the most accessible healthcare providers. And so they wanted to be that in their community. They've seen that in their community through some of their relationships in the past. And so I think with where sort of pharmacy is today, we have this opportunity to innovate because, that's part of, like, sometimes people are like, well, I hate that where it is, or, all those things. But I think it gives us a greater opportunity to innovate and become a new profession in a way. And getting back to some of the roots of what pharmacists did in the past too, when we talk about herbal therapies and we talk about compounding, and integrative pharmacists are getting, into that compounding focus, and having their own compounding facilities and stores. And so it's really coming full circle, I think, in a way, to where we had pharmacists used to be the business owner, the person that was managing the store and the services and everything. And for a while it wasn't like that. And I think we're moving into this. Pharmacists actually are still wanting to be entrepreneurs and serving their communities in that space. And so functional medicine really allows for us to do that, whether it's in a digital telehealth format like our format. But it still helps. We still have to, in order to market, have to get out in the community. I have to give presentations, in my community, whether it's at my daughter's school about stress for the moms, or if it's, other places. So I think it comes down to really that service aspect, and how do we actually serve people and get them well? Because I think pharmacists are seen after they work for several years. And acute care is a different situation. Acute care, we see the people get so much better from the day they hit the door in the ER to the day they leave. You see that full circle process. But with chronic care, I think over the time, whether you're in community ambulatory care in a health system, you see just that the patient is getting the medications and more medications and more medications, to the point where they're at 20, 30 medications sometimes. And you also, all the while, don't see the patient thriving. You don't see them getting well. I actually recently put thrive on my license plate, because I wanted to have this conversation with people, pharmacists as well as patients, that you don't have to just say, oh, I'm surviving, I'm making it through, this is just what I do. Like, that's not what we're here to do. We're here to thrive, whether that, in your spiritual context, in your community, in your job, in your family life. And it's all about, how do we feel fulfilled in all those buckets as well. And so I think that is really the reason where pharmacists are moving into functional medicine, is because they can feel fulfilled in their career. They can see the patient get better by putting in these nutrition principles. And it's not all about just selling them supplements instead of medications. It's about getting to the root cause of their underlying pathophysiology, and what's actually going on. And IBS is always our biggest example. Like, it's not just we need something to make things go faster or slower. We need to figure out why you're actually having this problem. Is it an autoimmune reaction? Are you having an imbalance in bacteria that's affecting motility? Is it stress induced? Is it nutrition and particular diet? Like, we're actually getting to that foundation, correcting it, and helping people not need the medications. And so some people always say, well, you're putting yourself out of a job, but it's like, not really. There's plenty of things going on in this healthcare system that people are going to need medications for. But I want those medications to be used in acute situations, and not in situations where they're going to, like, they take a medication. And I've been in the diabetes space for over 12 years, and patients will ask me, well, if I start this today, do I have to be on this for the rest of my life? And I want to say no. I want to say that you can have this opportunity here to reverse this. And in some patients, I will have that conversation, that this is not a lifelong sentence, but you have to do XYZ to get off this medication. You have to incorporate the nutrition, the diet. You have to change some things. You have to start moving and exercise. When you get those patients that aren't willing to do those things, it might be something that you're going to take for the rest of your life. And so, but to be able to have that conversation, that there's another option than just taking medications for the rest of their life, is so empowering, not only to the clinician, but to the patient, that I think that's really what drives people here.
Where do you see functional medicine pharmacists meeting with their patients? Are they doing it online, in person? Where are they meeting with them?
Yeah. So it's definitely a blend. I've got some pharmacists within our team, even that are meeting at their pharmacies. So they're pharmacy owners, they're adding this service into their practice. Most of our team meets in a telehealth capacity. So patients find us online or we find them in the community. They sign up with us. But we also meet at locations. So I have a doctor's office that I contract PharmToTable to on a certain day of the week. And so we're expanding those type of opportunities. And one of my pharmacists is in Minneapolis, and she's branding herself as the coffee shop pharmacist, and she's posting like what coffee shop she's in that day. And this is where people can find her and get to know her and learn more about services and what functional medicine looks like. So it's really
Awesome.
can be anything that they want it to be. I will say ambulatory care has my heart. That's what I've been in for this whole 12 years. And that is like the most optimal opportunity is when you're integrated into a physician's office. We work with physicians to order labs and things with our telehealth business, but when you're actually in there and you can, directly work alongside those other providers, whether they're PAs, nurse practitioners, physicians, to make changes and order labs and do the follow-up all as a team, it just really solidifies that care team and that approach. So it can be anywhere. And hospital pharmacy, there's definitely room for having some of these conversations, especially when it comes to probiotics and where we use that with patients that have different infections and are on antibiotics. And I mean, that's just one starting point. I think there's a lot of other places, like from a stress reduction standpoint, how do we help patients in these severe, these very stressful situations heal faster because of those things. So there's lots of places it could start. I think it's really the starting point is the pharmacist getting in their minds like, okay, there's some other things that we could be doing here, other ways we can be helping people get well. How do we look at what we're doing and what's broken about this picture, and how do we incorporate some of these other modalities to see if we can get better outcomes?
Location, location, location.
Yes,
You gotta
yes,
meet them where they're at. If they're in the
yes.
doctor's office, let's be working there. If they're in the
Yeah,
coffee shop, let's meet them there.
exactly,
Absolutely.
exactly.
If they wanna do telehealth, let's meet them there. That's great.
Yeah.
You have a team. You have a big
Yes,
team at Farm
yes.
to Table.
Yeah.
It's nice to hear that they're thinking outside the box and just
Mhm.
going where the people are. That's fantastic.
Yes.
Now, let's talk about your team for a minute.
Yeah.
How many people are on your team? Because your website shows a lot of happy faces.
Yes, yes. So we have about 30 pharmacists contracted, some, give or take different situations, but and we're still looking to grow we're sort of on a pause right this second of onboarding. I got to a point where I was onboarding people all the time that I was like spending my time always onboarding. And so we're moving to a process where we're going to be onboarding July 1st. So like we'll be doing like May and June sort of question and answer sessions. And then deciding who's a good fit for July. And then the same come January 1st, we'll be doing some of those same conversations coming up here in November and December. So if you're interested in learning more about our team, you can go to the PharmToTable website, which is PharmToTable.life. LIFE, and hit our contact form and send us a message through there about the team. But so in November and December, we'll have some more meetings and onboard some more people in January. But really what we're looking for is people that maybe don't want to run all aspects of their business. They don't want to have to do all the website, all the marketing, all the things on their own, but they're still willing to put in the time and the work to develop. So they're still independent contractors in the sense that they're their own business contracted to us. And we're working with them to help develop their practice, help them with marketing tools, help them with coaching on their own side, like the business coaching side. Like, how do I actually go out into my community, have these conversations? What are the barriers? What's preventing my mindset from getting from point A to point B? So we have some great people on the team, on our leadership team, that are also involved in coaching the other new pharmacists. So but yeah, and we do want people to have some level of functional medicine continued education at the least, if not started into some kind of certification process. But we also have there's not one of the benefits of working with a team like ours is that we are already seeing patients and we can pull people that are new into those visits so we can sort of all be on the call. So you get some clinical real life education, because there's not a lot of residencies, clinical training that are really for pharmacists at this time. I would love someday to have like a 2-year fellowship in functional medicine for a post-grad person that would go through like one of the training processes, but also work with our team during that time. We're just not quite there yet with volume to make that financially feasible, but that's definitely something that is on the vision board for sure. But really, it's interesting right now. It's all women, and not for me declining anyone from being part of the team. I just think that women in general are more looking for that community aspect in what they're doing, and sometimes like taking more not always, I don't want to make a big judgment, but a lot of times taking a lot of responsibility at home for family. And so that means that they need to look for these alternative ways to fulfill the career bucket, but also take care of this side of things. And so it's definitely been really refreshing. And I'm so excited. We're about to go to Nashville together and have a retreat and a conference. And there's just so much energy in a group of people. And you probably experienced this at some of the conferences. And I know you went to Metapreneurs recently, but so much energy in people that are in the same like boat and bucket of life. They're just excited about moving forward, excited about working, and excited about, making progress and innovation in this space.
You have so many great things going on. I would love to comment on a million things that you just said, but I want to say that mentorship is so valuable. You're
Hmm.
talking about having some of those less experienced functional medicine pharmacists
Hmm.
on calls with actual patients and
Yes.
seeing how it's done.
Yes.
Wow, that is a
Yeah.
valuable opportunity.
Yeah, it's really cool. Yeah, I had one recently that one of my new pharmacists is licensed in Virginia, and I'm not licensed in Virginia, but because she is, like, I'm like, we're going to put your name out there and put you on the website. And even if you're not ready to see patients, like someone will do it with you. And so she and I both saw the patient together, and yeah, it's a full learning experience and opportunity to continue to serve more expanded people as we expand the states that we cover too.
You brought up a really good point. One of the features of your team tab on your website is that you can search by state to
Yeah.
see. And I got to say, I was proud to see 5 Ohio pharmacists
Yes.
on your
Yes.
website. Go
Yes.
Ohio.
Yes, go Ohio. Yeah, and we also have, even more, like, Ohio grads too. There's some Ohio grads that are out in other areas right now, but yeah. Yeah, I
Awesome.
mean, Ohio is definitely, I mean, where my biggest network is, and, where we've sort of founded, our programs. So, but yeah, we definitely have a lot of movement in, California and Illinois and some of the other states that have bigger cities that are thinking this way. People are looking for this type of service. So, but not to say that we're not, working in other areas of the country too. But
Well, functional medicine pharmacy is certainly growing.
hmm.
But for anybody listening, maybe a student or a pharmacist who didn't grow up with functional medicine like me, I'm more than 20 years out of school. What would you say is a really great example of a patient case that you've been able to have a huge impact on because of functional medicine?
There's a lot of people right now that are experiencing what we would call like biotoxin illness. And I know that may be a like crazy term to like newbies in this space, but they have chronic infections, whether that's a chronic GI infection, whether it's yeast overgrowth or imbalanced bacteria. They've got sometimes chronic Lyme disease. Sometimes they have mold exposure, and their whole body is just sort of shutting down on them in a way. Like they've got brain fog. They're not able to sleep well. They're tired all the time. Some of them have really bad muscle aches and pains. I had one person recently that presented with a knee effusion, and this is actually related to like specific Lyme strains. And this whole Lyme and mold space is like so new to me. I'm like learning alongside the patients in a way, because it really came to the point where I was doing a lot of metabolic things, a lot of autoimmune Hashimoto's, a lot of gut things. But then these people started coming with these more complex situations. And I thought, well, my first thought was, well, I can't help them. I'm not trained in Lyme or I'm not trained in mold and all those things. But then I thought, you know what? No one else is helping them. No one else is looking at this deeper than the standard process. Most of their doctors, the one with the knee effusion, she was basically getting chronic steroids like every other month for this swelling in her knee. And her doctor was like, I don't know what to do with you, is basically what the doctor said. And the other patient that I'm seeing with some similar issues with really severe fatigue and brain fog that was exposed to mold in a workplace, her doctor also said, I'm willing to work with you, but I don't know where to go from here. And so that's really like the patients that I've really felt like recently that we've had the biggest impact on. I will say we haven't even gotten to like specific treatment for this patient's Lyme disease. We've just addressed her gut health and took out a lot of like food sensitivity reactions that she was reacting to, and given her the gut healing protocols and products and helped with some nutrient depletion things. And she's already hardly having any symptoms anymore. Like she's feeling great and able to take care of her family without taking taking steroids. I think to a level, like she's on the edge of some of that effusion things, especially because she recently had a viral illness and her immune system was like heightened. But I think those are the people where I'm just like, wow, like if I wouldn't have said yes to like digging deeper and to figuring this out with you, like you'd still be taking steroids like for every 3 months or every 2 months, and maybe more often than that. And like long-term, what's that doing to someone's body? So those are like the big wins, I think, is sort of peeling back the layers of like what's going on here. It's not just this chronic infection, but the intestinal permeability and the nutrient depletions and the stress management and the nutrition, like all of that comes together. We always say it's peeling back the onion and a little bit at a time, like we're working to get people better. But other more simple cases are just those people that have chronic diarrhea and constipation, and we figure out what the root cause is and they come off their medications. I had one gal that was vomiting so bad and so nauseous that she was going to the ER frequently for medications and in severe pain, and figured out it was small intestinal and bacterial overgrowth. Yeast was involved. So we treated all of those things. We worked her off her PPI, and her liver enzymes were super elevated. We like addressed liver health and things like that from a holistic perspective. And her liver enzymes are back to normal. Her bowels are basically back to normal. She's on minimal medication. So it's really about, that quality of life. I mean, I just wish it's really hard in this space to capture like the quality markers and the money saved to the healthcare system, because it's so different in every patient, because it's so individualized. So that's one thing on our side for employer health programs and things we're trying to figure out. What does that look like? How do we capture that and really put this forward into a larger space? But we're working on those things and have some good partnerships coming up. But yeah, really just, I mean, when you see someone like, oh my goodness, I feel so much better and I actually have the ability to take care of my kids and be involved in my community, it's life-changing for them. So that's really what we're here for.
Certainly, you're improving quality of life and
Yes.
improving activities of daily living.
Mm-hmm.
That's huge. That's
Mm-hmm.
something you can't even assign a savings
Right.
to.
Right. Yeah,
Yeah.
exactly. Yeah, and that's hard. It's hard in the pitch to like, how do I sell this to employers when I don't have that hard data or the hard cost savings that they're so used to seeing? It's really someone else that just has to say, yes, I hear that. I've been there. I understand that mission as a place to start. But yeah.
Well, keep doing what you're doing. You are changing lives.
Yes. Thank you. Thank you. Thanks for having me.
Oh, yeah. Well, you're very welcome.
Mhm.
You already talked about online CE, but you are also an educator in real life, in physical space.
Yes.
Yeah. So what is this other thing that you do as an educator?
Yeah, so I have a lot of different hats as an educator. So one is I've been in the diabetes space for my career, and so doing diabetes education, carb counting with patients, teaching them to read nutrition labels, teaching them how to use insulin pumps. So I do some insulin pump trainings. And really also in that space, like educating pharmacists how to even practice in the ambulatory care too, as part of my consulting. So those hats, and then even teaching other healthcare providers about safe uses of medications is an important piece. How to use CGM, where the CGM benefit is in the patient, in the conventional model, and in the integrative side of things. So I think, it's funny because coming from academia, you think like your career was focused on education then when you're teaching pharmacy students and teaching physicians that you work with. But in reality, like I think most pharmacists are in some level of education, whether it's you teaching the patient directly about something or teaching your staff about something. There's always that education hat that is at play, and even precepting and different types of education. So there's always ways to be teaching and passing the torch per se.
Yeah, well, what I was kind of aiming for was to get
Oh,
you to talk about Cedarville University because you're an
oh, I
adjunct
gotcha.
professor.
Yeah,
But hey, it's all
yeah,
good. I love hearing
yeah,
how people
yeah.
use their voices to advocate for stuff
Sure,
and
sure.
educate and
Yes.
entertain. Let's go.
Yes, yes. So I had worked full time for Cedarville University, helped launch the pharmacy program there, and I think that's where some of the innovation hat stuff comes from. And so I worked there from 2010 to 2000, actually 21, in some capacity. The first 6 years full time, and then the rest part time. And then more recently, have just been adjuncting with them, which has been still fun and still able to go in and do lectures in diabetes and actually teach a functional medicine lecture in the endocrine module, about an introduction to that. But more recently, I've also been adjunct at University of Findlay here in Ohio and actually have been doing a elective in functional medicine, with a small number of students, but it's online, sort of asynchronous type education. They're utilizing a lot of our content from the FX Med CE side. So it's really fun to see like the light bulbs go off with the students and like, wow, there is a different, and it takes, there's so much political piece of a lot of this medical stuff and views on evidence-based medicine and pharmaceutical companies and the process of evaluating literature, that sometimes it takes a little while to gain their trust and see like past some of the standard process in the classroom. And I will say that is a little bit hard as an adjunct because they don't know me from anyone, and I'm coming in and saying this is this new thing and this is the way it should be. When they have no idea, they've been taught this conventional process like up until this point.
You're like a floater professor.
Exactly.
Yes.
I will. Yes, exactly. It's like when you go into a store and like the staff doesn't know you and you're like, okay, well, this is how it needs to be done today. That little label that needs to go on the barrel of the inhaler, like I need you to put it on today.
Yeah, sorry to interrupt you, but as you were talking, I was like, yeah, you gotta get them to actually listen to you and trust what you're saying.
Right.
Yep, it sounds like
Yeah,
a floater.
yeah. Yes, exactly. Yeah, but from the semester long course standpoint, it's a little bit, and obviously those students signed up for functional medicine, so it's a little bit different in that setting. But I think, students, I mean, academia has changed a lot over the years, but I think the cool thing is there's a lot of innovation now that there's more pharmacy schools and they're figuring out like how to be competitive, how to impact their communities, how to really change and advocate for the profession. So it's fun to still be involved in that at some level.
Awesome. Well, and I think what we're going to do is wrap up this interview with you talking about your podcast. You are
Yay.
an entertainer, whether you would call yourself an entertainer or not, but you do have a
Yeah.
podcast. Let's talk about your podcast.
Yeah.
It is called
Table talk. So it's funny because one of my pharmacists, Nicole, we were brainstorming names about what our podcast should be named, and she thought of that name, and I was like, "Oh my goodness, that's perfect!" And then there's like a million other table talk podcasts out there. So, but I just kept coming back to it because I was like, it's exactly what we want to like people to envision, that they're sitting at the table with us, having a conversation about their health or having a conversation about a health topic, but it's this virtual table instead of a physical table. But so much of functional medicine, one of the elements of like a foundation of health, that Institute of Functional Medicine is all about, is community. And so, we just wanted to really put that vision in people's minds as they're listening to our content. So if you can't find it easily in iTunes because there's a million other table talks, you can just go to our website at the farmtotable.life/podcast, and all of our podcasts are housed there. And then you can go over and subscribe in iTunes or other methods. But we actually have almost 20, actually now 20 episodes. So by the time you're listening to this, probably a little bit more than that. And so we really started at the beginning about, okay, what are the foundations of health? And what does that look like from what is functional medicine? What is the foundation of health and nutrition, sleep, stress, movement, community, like I mentioned. And then we started to dive into other more specific topics. So as far as who this podcast is for, like our audience is definitely in this realm more patient focused. But I would say that if a pharmacist is interested in learning like some of the basics about functional medicine and interested in hearing from other pharmacists and their thoughts on this topic, like it's also a perfect podcast for them to listen to too. We don't dive into the science part, like as far as like I mean, we do some at some level, but like a high educated patient friendly level. We're certainly not going down to like a fifth grade reading level like we're taught in pharmacy school for all audiences, because that's not necessarily necessary for our audience. But I would say most of our audience is like educated, maybe went to some level of college type patients. So that's really, who we're targeting and how we're explaining the science to in that aspect. If you're a pharmacist listening and you're like, hey, I want to dive deep into the science and I want to listen to a podcast, then you should check out Kara Fitzgerald's podcast called New Frontiers in Functional Medicine. She's a naturopathic doctor that interviews her like slogan is she interviews the great minds in functional medicine. And that's exactly what she does. She interviews researchers, doctors, all kinds of people that are doing the latest and greatest in that space. So a little bit different audience for that versus the functional medicine CE, but a great place to start too.
You've been on that podcast, right? Greatest
No,
minds in
I
no?
haven't. I haven't. You know what I should ask though, because Lara Zakaria is one of the pharmacists that does a lot of teaching for us, and she actually works for Kara Fitzgerald's clinic. So I probably should put that bud in her ear sometime.
Absolutely. I think you're fantastic. I love your advocacy for functional medicine, for
Yeah.
pharmacists to become functional medicine pharmacists. I love your
Mm-hmm.
advocacy for the patients. That's fantastic. I love that you use your voice as an educator in a number of ways. That's fantastic.
Mm-hmm.
And then who can deny that you're an entertainer because you have a podcast? You fit my
Right.
criteria perfectly.
Good, good. Well,
Yes.
I'm glad to be here and to be able to share more about it.
Yeah, well, it's my pleasure to have you. And is there anything else you'd like to share, opportunities to connect or anything else?
Yeah, yeah. So we have an Instagram page for the PharmToTable team. It's at PharmToTable team. My page right now is at pharmtotable.life on Instagram. And then we have Facebook page, Facebook groups. If you're super new to this and you just want to like make a change for your own health, we actually are doing a 14-day reset in November with our PharmToTable team. That's going to involve some nutrition support and some coaching. That's a group program, and so that's on our PharmToTable site that you can check out. So we'd love to have you for that too. So lots of fun stuff coming up.
Awesome. Well, I wish you continued success, Dr.
Thank
Melody
you. Thank
Hartzler.
you.
Yeah, you bet. And OH. IO. All right.
OHIO.
All right. It's been a pleasure. Thank you and have a great fall.
Thank you.
Thanks again to Dr. Melody Hartzler for being my guest on episode 181 of the Pharmacist Voice podcast. I am not in clinical practice anymore, but I am interested in functional medicine pharmacy as a patient. So I'm going to check out that 14-day reset. I went to the website, it's $49. If you are interested, register at pharmtotable.life. Now, as a person who's trying to live her healthiest life, that's right, I'm trying. I have checked out the podcast, Table Talk podcast. I like it. Now, if you're interested in the Table Talk podcast, the easiest way to find it is by going to pharmtotable.life, pharmtotable.life, and click on that podcast tab. When Melody said that there was more than one Table Talk podcast, she wasn't kidding. There's more than one, a lot more than one. Now, I like to hit the easy button, so just helping you out here, I found the Farm to Tables Table Talk podcast through the website, pharmtotable.life. If you're a functional medicine pharmacist or functional medicine pharmacy curious, I can see the attraction. This was a great episode. There is a lot of opportunity to impact patients, right? Impact patients and feel like you're making an impact with functional medicine. No matter where you are on your functional medicine journey, patient, pharmacist, etc., I wish you the best in your functional medicine endeavors. Now let's wrap this up. Thank you for listening to episode 181 of the Pharmacist's Voice podcast. Please visit thepharmacistvoice.com to read the show notes. A link to Melody's social media pages and websites are in the show notes. Register for that Functional Medicine CE Virtual Symposium, which is on November 12th, 2022, or register for that 14-day reset like me. It's already mid October and the clock is ticking. So if you want to register, check those out now. And I realize that some people find my podcast episodes way after opportunities have passed. So if that is you, check out the websites anyway. PharmToTable and Functional Medicine CE will surely update their content as time goes on. Also, in the show notes today is a link to Dr. Kara Fitzgerald's New Frontiers in Functional Medicine podcast, Cedarville University School of Pharmacy, the University of Findlay College of Pharmacy, and my social media links. As always, please feel free to reach out to me and connect. If you know someone who would like this episode or needs to hear it, please share it with them. And subscribe to or follow the Pharmacist's Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Thanks again for listening today. I'll be back next Friday with a solo episode. Thanks again for listening. I'll talk to you next week.